Heart valve surgery is needed for either diseases of the heart valve that a patient has acquired during his life, which in most cases is a narrowing of the valve, or it is needed for patients who have been born with a valve that is either diseased or is not functioning valve. Heart valve surgery can generally be divided in two different methods, either a repair of valve of the patient or a replacement of the valve of the patient. When replacing the valve of a patient, there are two possible ways of doing this. Either one chooses a mechanical prosthesis to replace his valve or a biological prosthesis. Heart valve surgery is open heart surgery. The surgeon has to open the heart, specifically the big vessel, the aorta, and either repair the valve of the patient or resect the valve and replace the valve with a prosthesis in order to produce a newly functioning valve. Either way, the replaced valve will work functioning well for a long time, and the patient can resume his life after a short while. The difference between mechanical and biological heart valves is that mechanical heart valves are engineered valves made from carbon, whereas biological heart valves are coming from either porcine donors, that means pigs, calves, or other cattle, and they are engineered around a frame. Usually after heart valve surgery, the patient stays in hospital for around 5 days before he's discharged. After the discharge, he then has to recover slowly in the form that he is able to do his daily exercises, walking, doing light work, and up to a period of 4 to 6 weeks he usually should be fully recovered and be back in full harness in his environment. This is truly depending on the way of the replacement of the valve. If the patient receives a mechanical valve, he will need lifelong anticoagulation. That means his clotting will be reduced and he will need to have some lifestyle changes in his life, whereas if he receives a biological valve, he will not need any medication for this valve and therefore will not have to change his lifestyle. If he has a repair of the valve, the same would apply for this. He would not need any medication.